Welcome back to continue our discussion talking about sports injuries and other things. Joining me again is Dr. Stephen Huang. He is with OU School of Community Medicine, and you're with the Sports Medicine Division. Let's jump in, time's never, my friend. Now, in the first segment, we talked a lot about jersey finger because I had that need, and
Sure.
it's a common kind of injury we need to be aware of. Let me switch to look at ACL injuries.
Okay.
Are those very common, and when do they tend to occur? Tell me a little bit about them.
Sure. ACL injuries are common in many different sports. Any sport that requires changing of directions quickly or pivoting, such as football or basketball, soccer, we see them fairly frequently. In other sports such as cycling or running in a straight line, they're really less frequent.
Okay, now what happens in terms of, sort of tell our viewers, where does that injury occur? Where is the ACL?
Okay. The ACL, it's also known as the anterior cruciate ligament, and it runs right in the middle of the knee. And what it does is it prevents translation of the upper thigh bone on the lower leg bone that makes your knee. Okay? And that's vital to the stability of your knee. Typically, we see this in someone who quickly changes direction. It's not typically a contact injury. What happens is the person plants their foot and then quickly tries to change direction.
Okay.
And then suddenly they feel or hear a pop, and they have immediate pain in their knee, and they drop to the ground.
Okay, now with this type of injury then, let me get to prevention before we talk about treatment. Can you prevent it? I'm a big one on prevention. I know we can't prevent jersey finger by the steel glove, but is there prevention, like with certain exercises to strengthen that, or knee wear or something?
It's a difficult answer. The answer is yes and no. Okay. There are certain things that you can do to try to prevent it, but is it truly prevent it? We don't really know. There's not a specific study that can say, you know, if you do all these exercises, your incidence or probability of an ACL tear would be less, because it really depends on what happens when you're on the field. Okay. The things that we'd like to do to prevent this type of injury is to make sure that you have good mechanics, and that you've got good flexibility in your knee, which would be your hamstrings and your quadricep muscles that support the knee. Okay. And then you've got good strength, especially of your quadricep muscles, because they stabilize in deceleration of the knee when you're pivoting.
Okay, so those types of exercises would be good.
Correct.
To help strengthen, if nothing else.
Correct.
Okay, now if one does get this kind of tear, what is the treatment for it?
It varies, depending on who you are, what you do, and what your goals are. Okay. Unfortunately, it also depends on whether or not you have insurance or no insurance. There are people who walk around in our community who have ACL deficient knees who do very well. Those people would not be playing football every Saturday or Sunday during the fall. Okay. The reason is because you know, if you go about your day and you work all day and you sit in a chair and you walk around, you may not need to have the most stable knee. But if you're constantly cutting back and forth, running, decelerating, pivoting, then you're going to want to have a more stable knee. Now,
when you say there are people that may be walking around that have this, even if you're not engaged in strenuous activities such as football and things such as that, couldn't your knee just give out on you at any point in time?
It can.
Okay.
And we do see this. Some patients come in and they do have a history of an ACL tear, and they can have an unstable feeling knee just by walking up and down the steps at home or walking on the street. And then you have other folks, you know, who never have any symptoms at all, and they may be very active, and they may have very strong muscles, and they may be, you know, running or doing exercises on their own time too.
So you can actually have the ACL tear in some situations and not even know you've had it.
Correct. Correct.
Well, that's frightening until something happens that causes that instability or something such as that.
Correct.
Okay, now with ACL repairs then, is it better to get it repaired closer to when the injury occurs, if you know it occurred, or for these persons that you're talking about that may not know until much later, would the repair be more difficult because there's been more scar tissue or something that's happening?
In contrast to the jersey finger, where time is very important and the earlier the better, for ACLs, it's not necessarily that way. And what I mean is that you know, if you were an 18-year-old football player and you have dreams of playing college football or pro football, then you're probably going to want to have it done sooner than later. But if you're the average person and you don't necessarily play sports for a living, then you know you can give it time and let the initial swelling and inflammation go away and see how stable your knee is. In many cases, you know, for people in the community who want to avoid surgery, this is acceptable treatment. And what you do is you know, you can go through rehab with physical therapy to strengthen the muscles around the knee, being your quadriceps and your hamstrings, and see, is it really unstable, or is it just the initial pain that's the problem?
Okay, so getting that repaired later is not going to be as damaging to you if you needed to have it done. I mean, there's not going to be a more difficult repair work that needs to happen or a longer recovery because you did wait.
Again, it's somewhat of a complicated answer.
Okay.
In certain situations, they do have a better response with early treatment if there are other things that are damaged in the knee.
Okay.
Okay, so other things that can be damaged are your medial meniscus, or your medial collateral ligament, and the studies show that, you know, if you've got meniscal tears, then generally an earlier repair is better than a later repair.
Okay. Now with this, then, let me ask about the recreational athlete or the person that's just exercising just for physical health.
Sure.
Are they prone to these ACL kinds of things?
We all are prone to it.
Okay.
And actually, you know, females in general are at higher risk than males, and it has to do with the difference in anatomy. That said, as we get older, we tend to not have the same flexibility and strength in our muscles. And yes, we do, you know, we definitely see them in the weekend warrior types as opposed to the younger types as well.
Okay, so is it more important or just as important for the weekend warrior to do those strengthening exercises and things like that? Because sometimes people just get out there.
Right.
They don't do anything to warm up or to do anything like that, but that's important?
It is definitely important. In most sports, you do want to warm up, and it's always hard to jump right back into a sport or exercise if you have not done that in a while, because your muscles are not necessarily ready for it, and your joints may not be as well either. Okay,
is the cool down just as important as the warm up? Because we've heard about making sure you cool down and slow yourself down with, especially the weekend warrior, with exercising. Is that really critical too?
I think it's an important part of it. It's not necessarily going to prevent ACL tears or other types of injuries, but cool down is important. Okay, so the whole picture.
Okay, well, what we're going to do is take another quick break and come back and talk about a few more sports injuries. Please stay with us. We'll be right back.